If you're all pissed off, you got a chip on your shoulder, you're going to walk around angry and upset. I've kind of noticed, generally speaking, the world doesn't seem to too much care.
No.
I mean, it's kind of like if you want to say, I'm going to go over here, sit in the corner and eat worms, the world doesn't stop spinning around. They don't care. I mean, you can impose that on other people if you have them under your thumb in some way. I mean, maybe if you're the parent and they're the child, or you're the boss and they're your employees, and you want to come in and spew that kind of toxicity. But generally speaking, the world doesn't care.
That makes them more angry.
Exactly. On the other hand, if you're optimistic and you bring that into the room, people tend to be drawn to you. It just seems to me there's a better way to go through this life than to be dragged kicking and screaming.
It's a great point. No one likes that angry friend, that angry coworker that is always annoyed about something. But, part of it, Dr. Phil, is, I think, as we've discussed, that's not our concept of health for the most part in this country. We think about health, and the medical community is partly to blame just on that physical aspects of your health. And then all of a sudden, if you have depression, we cart you off to a whole nother specialty, right? And don't want to address that issue. And we fail to recognize at times that it's a continuum. And we don't talk to patients, we don't talk to the public enough about that and its relationship to the physical health and the mental health. You can't have one without the other. And we don't always acknowledge that. And then people don't feel they need to change anything.
I guess that's why I'm saying, if you're going to be in this world one way or another, why not choose something that works for you? Why not choose something that makes you smarter, healthier, more efficient? For example, we know that if you multitask, you're going to be very inefficient. Because we know if you're working on emails and somebody comes in and says, can I discuss with you a problem on the production floor at the factory? Just take a minute. Well, we know the brain uses different parts of the brain for different tasks. Well, you've got to disengage from this, engage another part of your brain, and that takes some time.
Yeah, because your brain doesn't fully disengage from the current. I love that you point that out, because people think that multitasking is a sign that you're really smart.
I've seen sophisticated job descriptions from Fortune 500 companies. When they're describing what they're looking for, they say in a positive way, are you a good multitasker? And the right answer to that should be no. I don't multitask, because if you don't multitask, your efficiency goes up an average of 42%.
That's not going to get you the job. We're going to have to say to your point, but you're right, exactly, in terms of how staying focused on one goal is going to more likely get you that result than if you're trying 3 different things at the same time.
It takes about 15 minutes to successfully disengage from one task and effectively re-engage in a second task. That task is going to take 2 or 3 minutes. Oh no. You spent 15 minutes disengaging there and re-engaging over here to do something for 2 minutes. Now you got to go back over here and re-engage over here. So you've spent 30 minutes disengaging and re-engaging to do something that took 2 minutes. What people need to learn to do is say, if you got a few minutes, actually, I don't right now, but if you'll just hang tight, as soon as I finish this, I'll buzz you in your office and deal with what you need. That's learning to set boundaries. That's having a strategy for the way to be in this world. It's controlling your relationships, and it's doing things that are going to be more efficient for you, your organization, your peace of mind.
And helping your health, your overall.
And it lowers your stress levels.
Without a doubt.
So that's what I mean about being who you are on purpose. That to me is the building block. That's the building block. Have a strategy, do it on purpose. When you get into like chapter 4 on page 39 of your book here, that's the first time we get into the mental emotional parts of this with depression. That's where people need to stop and say, okay, this is up to me. I have to manage this. And not only will I address my depression, but it will improve my heart health, lower my risk factors, and put me in a better position for longevity and quality of life.
You know what I learned from you, Phil? And I've learned a lot of things over the years, but something that I learned from our discussions is you noticed I put the mental health aspects of the book at the beginning.
Yes, you did.
And I put the things like diet and exercise, a menu plan that I worked hard on, and an exercise strategy. I put those at the end. And I purposely, from our discussions, said, I'm going to put this at the beginning because I want to make sure that people read this, that I make sure I have their attention. And that's not something that I would have done, Phil, years ago.
Really?
But it's something that I've learned. I don't even know if I would have had some of those chapters in the book, but I've learned a lot. And that's where I feel that this can be a benefit for people because not enough doctors are talking about it. And you can do all those things right. And if you're chronically depressed, if you're anxious all the time, you're chronically stressed, you're still going to increase your risk. And I would argue you're still going to have lots of challenges. And if you don't address those up front and early on, it's going to create major problems.
Yeah. Well, I love your chapter towards the end, putting it all together, because you don't get to medication until chapter 9, because you put a lot of this onus on the individual.
Yeah.
To manage this.
We're too quick sometimes to say medication.
And then to medication. And then in your conclusion, it's putting it all together. I really liked that aspect of this book. Like, all right, let's tie all this up together after you've given them all the different elements and aspects of managing the risk. I don't see how anybody can read this book, and you can see mine is all dog-eared and marked up and stuff.
It's very well read. Thank you.
But I don't see how anybody can read this book and come away without a strategy for reducing their risk for heart disease. People go, yeah, and it's like they can't see it, so it doesn't seem as real. But this book is going to save people's lives.
Well, thank you. And really the focus was on, because I hear this from patients all the time, tell me what to do. Tell me what to eat, Dr. Whyte. Tell me how I should exercise. And, I can't tell you everything that you can do, but I can start to provide that framework. I think about a WebMD interview we did a few years back, which is one of our most popular, where you talked about in the setting of New Year's goals, you have to have an action plan, right? You have to have a strategy. Otherwise, you're going to fail. And they're not, true goals. And that's the concept that I took for the book as well. I've got to give you a plan. And whether it's a meal plan, an exercise plan, but also a plan to address your mental health.
Yeah. And maybe this is hard for some people because when I was in private practice, I had people that I worked with for years that never knew they were depressed until they weren't. They just thought that's how life is. They never knew they were depressed until it lifted. And all of a sudden, they had an optimism about them. The sky was blue. It always had been, but they never noticed it. They walked around with their head down. All of a sudden, they looked up and looked people in the eye, and they really heard music for the first time. They saw the world for the first time, and they went, wow. It's like I've been living in black and white, and the world's in color. I've missed it all these years. And I said, it's because your depression has lifted. Biochemically, emotionally, behaviorally. And they said, wow, I never knew I was depressed. I just thought everybody was in black and white. So ask yourself, is there more to life than what I'm living? Because if in fact you're living with depression, anxiety, stress, and loneliness, there are biochemical correlates to that are burdening your heart. Not emotionally, burdening your heart hormonally, biochemically, and structurally that could be shortening your life and certainly changing the quality of your life. That's like a sleeper cell that can flare up on you at any time. And if you change that, you can improve your health. You can improve your risk for having a heart attack. I'm not saying don't exercise, not saying don't have a good diet plan, not saying don't go see your internist, your cardiologist, but also recognize you can help yourself if you get yourself emotionally straight.
That's right. And life can be challenging at times. Life can be hard, but there are things that you can do. There are perspectives that you can change that really can get you on that path to better health because you want that quality of life. It's not just the number of years, it's the quality of the years as well.
Yeah, for sure.